We're often asked why we take our three-dimensional x-ray before we start braces. So I want to explain some of the reasons of the why. So I've got a patient here that we look at that has some spacing in between her teeth, does not have a lot of room for her lateral incisors, and I can just tell her the width of her upper jaw is, and this is the upper jaw shot into a mirror, is narrow compared to her lower jaw shot into the mirror right here. So I wanted to kind of widen her arch, but while we were doing this, we had the patient fill out a questionnaire about sleep habits. And the patient snored, and as the mom said, snored like a bear, and was a mouth breather, and those are two big red flags that there's airway issues going on. So you take a narrow arch, you take snoring, and we take mouth breathing, and we want our patients to be breathing through their nose when they're sleeping, when they're watching TV, playing video games. That's the most healthy way to breathe. So we're going to look at the traditional panoramic in the past, but now this offers us a 3D version of it. So the first thing we do is we want to count teeth, because we want to make sure there's no missing or extra teeth. So I can look in here and count teeth and see that she has all of the normal teeth that we need. And here's the permanent teeth. Now we don't see the wisdom teeth forming just yet because of her age. Barely, there might be the start of a bud right here, but here's her 12-year molars right there. So first thing is, do we have all the teeth the right number? The next thing is, especially because of our questionnaire, they snored. So I'm going to now look at tonsils and adenoids. So what we do is we look right here, and this is a slice going right through kind of the middle of the head. This yellow line right here depicts where we are on this bottom screen. So if I get this in about the middle right here, I can look, and that airway is pretty narrow. Now about right in here is the adenoids, down in here is where the tonsils are. Kind of up in here is where the tongue would be. So as I just start to move this to the side a little bit, all of a sudden we see the airway closing off where the tonsils are big. So I can already start to see from there that she could be easily having airway issues that causes her to snore and sleep with her mouth open at night just to be able to breathe. The other thing we look at is this cross section right here. And I can zoom in and out. If you look at this orange plane right here, this is the level we're at. So I can go all the way up to the top, and we come down. This is the upper arch. Keep coming down, and I'm looking at the airway, and all of a sudden it starts to really impinge right there. Right there, and those are the tonsils almost coming together, and the airway is really small. And we think about breathing through a garden hose versus breathing through a coffee straw. We want to set the patient up to have an environment of breathing through a garden hose so that when they exercise, just normal breathing at night, they can get good oxygen in and breathe well. You get to a coffee straw and it gets struggling. So that's why we're trying to do some early orthodontic type things and partner with our local medical physicians. This girl actually went to the ENT and had her tonsils and adenoids taken out. 3 months after, we see the patient, and mom says hardly any snoring at all, goes in at night, breathing through their nose, which is the way to health.